cancer is the most common cancer in the United States, yet a lot of people don't take the necessary steps to decrease their risk or fully understand the dangers of unprotected sun exposure. To talk all about that, how to spot some warning signs, we have Dr. Sarah Kitts with us with Cone Health Alamance Skin Center. All right, so let's just kind of address the seriousness of skin cancer. Some people mistakenly think it's just really not a big deal.
Yeah, so it's definitely a very big deal. I would say about 1 in 5 Americans are diagnosed with skin cancer in their lifetime, and about 10,000 cases of skin cancer are diagnosed by dermatologists every day in the United States. So it is something that will probably affect you, a family member, or a friend, and it's definitely something that you want to take seriously. I always tell my patients it's kind of the bulk of what I do. I would say about half of my days are spent kind of doing skin cancer checks and skin cancer screenings, diagnosing skin cancers and managing skin cancers. So it's a lot of what I do. Whenever I'm diagnosing a skin cancer, I always tell my patients it's typically not something that you want to lose sleep over, but it's definitely something we should take care of. For the most part, especially when caught early, skin cancers are, pretty easy to treat with in-office procedures. So like small surgeries, sometimes we can even do what we call like a little scrape and burn procedure, which is a little bit less invasive. And sometimes when it's just in the top layer of skin, we can actually do like topical chemotherapies at home as well. So the sooner you find these spots, the easier they are to treat. The longer they stay on the skin, the more likely they are to kind of invade into local structures and spread to like nearby lymph nodes and organs, which is absolutely what we want to prevent.
Yeah, we do not want that at all. Okay, so there's a big misconception that only fair-skinned people are at risk of skin cancer. So can you kind of clarify just who is at risk for skin cancer?
Yeah, absolutely. I would say everyone is at risk for skin cancer. So it is true that we see a higher incidence of skin cancer in more fair skin individuals, but we can see skin cancer in patients with darker skin tones as well. I would say in darker skin tone patients, we tend to actually see skin cancers in areas that are not typically exposed to the sun. So that's areas like the palms and soles, the nails, the genitalia. So I always tell my patients who have kind of darker skin tone, you do want to really be on the lookout for new kind of changing moles in those areas. Because oftentimes when we diagnose in those areas, they tend to be more progressed and advanced than the average skin cancer.
Right, I don't think anyone ever thinks that they're going to get skin cancer on the bottom of their feet.
Exactly. Definitely look between the toes and on the feet.
And so you're saying if there's any kind of like surface of our skin that looks like it's changed or something like that, even if it's not something that would be available to the sun, we should have that checked out.
Yes, absolutely. Skin cancer can pop up anywhere, even if you haven't had sun there.
Okay. All right. So sunscreen, of course, is like the most common thing for protecting against skin cancer. What are some like common mistakes that we're making when we put on sunscreen?
Yeah, so sun protection is really key to kind of protect your skin from skin cancer and skin aging. I always tell my patients you're looking for a broad spectrum sunscreen. So that means it's protecting against UVA and UVB rays. You want to look for an SPF of 30 or above, but really the higher the better. And when you're outside, you really want to be applying that every 2 hours and sometimes even more frequently if like you're in the pool or at the beach. I see a lot of mistakes in how much sunscreen patients are using. So if you're not using the correct amount, you're not getting that enough protection. And so for kind of like a full body sunscreen application, you do need a full ounce of sunscreen. An easy way to think about that is you need like a full shot glass of sunscreen for your entire body. And
Okay,
I
and that's
recognize
just for one person, right? So,
that's for
like,
one.
if you've got a family of four and you've got an 8-ounce bottle of sunscreen, you're probably going to go through that whole bottle of sunscreen if you spend a whole day at the beach.
Exactly. You should be using a lot of sunscreen, especially when you're at the beach. And I recognize not everyone is putting sunscreen all over their entire body every single day, but I always tell my patients like face, neck, and chest every single day when you're leaving the house. An easy way to kind of think of the amount to use on your face is you want kind of 2 fingertip units to cover your entire face and neck. And then kind of one other common error I see with sunscreen application is not kind of applying to kind of certain areas. So areas that get forgotten a lot are like the backs of the hands, the top of the ears, the backs of the neck, and often like in the part line, especially if you have thinning hair.